Okay, so with nervous system conditions, the reason why I want to talk about, like, first of all, how to clinically problem solve, or to think about patterns rather than memorize every single condition and every single detail. There's actually many reasons for it. I mean, one of which is that there's so many conditions and so many details. But also, we want to think about this when you're studying your textbook or your lecture notes, or, you want to think about this from a clinical standpoint of when you see your clients, what information are you most likely to know about them? What's going to be in their intake charts? And also thinking about the fact that a lot of times our clients don't necessarily have an official diagnosis, and sometimes they're self-diagnosing. And this can be for various reasons, including sometimes they don't have health care, or they're waiting to see a specialist. Some of these things take a long time to diagnose. Some of these things are things that, not everyone even believes in. If we look at mental health stuff, some of these things like mental health are stigmatized by some people in some cultures. And so, people are going to have very different relationships to these different topics, right? And also some people don't trust the doctors or medical system. They want to self-treat. So you're going to have folks coming to you kind of from all different places, right? And so you're not always going to have someone say, I have this condition. And so then you can just think, well, what is contraindicated, right, for that condition? Sometimes the client is just telling you signs and symptoms. And while we definitely cannot diagnose, we need to think more in terms of what just knowing the signs and symptoms might possibly be going on. And do we need to refer them? And if and how do we need to modify the treatment? And I'm really bummed. I don't think I'm recording any of that. That's pretty annoying. I don't want to bore you with that whole introduction again, but I realize I'm not recording.
It says recording.
It's recording? Oh,
yeah.
Thank goodness. It's been that kind of morning. All right. So, and then again, some of these things, even if the person wants to seek treatment and diagnosis for it, some of these things can take, believe it or not, years to diagnose. If we're looking at things like fibromyalgia, or, and then, different mental health issues, which of course are super, 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 super common. You're going to have folks having, for example, different relationships to what treatment they're doing. And if they're doing medications, sometimes those take a long time to kind of find medications that sort of work and are on board enough, and they need to change doses. And of course, there might be self-treatment that could include, use of CBD and things, or so really a lot of different things going on. And so these conditions that we're going to see a lot, like mental health issues like depression, anxiety, and so forth, you're going to have a huge number of patients with things like that. Those things we'll kind of discuss more, and really into the day-to-day of your clinical practice, right? And then other things that you're maybe not going to see as often, we want to make sure that, you kind of know, how to figure out your basics of what's safe and what's not safe. And then, when to look things up, and also how to look things up, right? Sometimes you might be about to start a session and you find out that you've got a client with something you don't really understand. And, if you work in a group practice, you have a chiropractor or other massage therapists with a lot of knowledge, sometimes you'll have time to kind of work with your team for some input. And sometimes you just got to do some research really quickly. I would say a massage therapist pathology book like this one is a great place to turn, because they've taken everything and applied it directly to massage. Whereas if you don't have a massage therapist guide with you and you just turn to the internet, a lot of what you find is not going to be connected to massage, right? Like even if you look at reputable sites like WebMD or research, papers, a lot of that is, they're not going to have as much information about massage. And if they say whether massage is a good treatment or not on something like WebMD, they're not going to be talking about like what specific massage is safe or not safe and things like that. So at the end of the day, it's good to have this type of resource. And speaking of which, as a reminder, there are several massage therapist books specific to medication. And for the same reason, I would recommend that you use one of those books instead of like just, doing a random Google search about medications online. Oftentimes, if you do a random Google search about medications online, you will find information that is either too detailed or not detailed enough, might not even be accurate, but most importantly, also not really connected directly to the practice of massage. So that's kind of my first advice. And so it's a really good idea to have a textbook like this available, because sometimes you're just going to need to look things up. Another thing that's going to be really good practice for you, and you'll get to practice this in clinic. Yes?
About the book, I have the version 4. Is that okay?
Yeah, any version is okay. Any edition is okay. The older editions, they're going to have some of the conditions in different chapters, and there definitely will be some differences. But if you could just use the index to look up conditions that are in a different spot of the book, you'll be fine.
Okay, thank you.
Yeah, you bet. They moved a few things around, but mostly it's similar enough. Certainly enough for your MBLEX. So then the other thing is, right, because there's going to be things where you don't know everything. The other thing is, I would really recommend that if you work somewhere that you can look at the client's charts ahead of time, that's a really good practice. So Jill and I were mentioning the other day that we both work at places that have electronic systems. I can literally, remotely right now look at my next clients, including all of their charts. And so you can do your research ahead. Now, of course, this is not a foolproof system. You can have clients who you research their past charts. And then, of course, they could have a new condition come up. They could be coming in for something different than they did before. And then, of course, you could have new clients that you don't really have charts for. But when possible, if you study everybody ahead, then you'll have more time freed up for anybody who comes in that you don't really have anything to study on them. And the more you do this, right, the more conditions you'll feel comfortable with, and the more comfortable you'll be to quickly come up with treatment plans. But at first, if you give yourself that extra time, you'll have more time to problem solve. And that's part of what we'll be doing, in clinic, is helping you with that. We will be studying the client's charts ahead, and we'll be helping talk to you about, well, what does this mean? And, because you'll have clients' charts, if you're talking about a paper chart, we'll have clients' charts that are like this thick sometimes. We even have some clients that have 2 full charts full. That's just like, and so when you study a chart, even, you're not necessarily reading every single entry ever, but like looking at patterns. And you'll notice that like some things happened longer ago that don't even get mentioned anymore, but it's good to look at old surgeries and injuries and so forth. And then it's, of course, our responsibility to ask follow-up questions. Yeah, Krish?
So you don't always get the same clients? Is that like you kind of work with the other massage therapists and things like that? Is that true?
I think I understand your question. Like, are you asking could you ask it again? Because I'm not 100% sure I understand the question.
like when you're at Elements, you don't always get the same clients. You kind of you get clients that other massage therapists work with also.
Oh, I see. Yeah, I think, yeah. Yeah, so I mean, I've worked at probably like a dozen or more places, and all of the places that have multiple massage therapists usually work in a kind of similar way, where if a client requests you, if you're available, they get to book with you. But if there's a place with multiple clients or multiple massage therapists, a lot of the clients, even those that really love you, will sometimes see other people too, usually because you're too busy for them to see all the time. So yeah, usually if a client asks for you, they can book with you again. But usually there'll be other people working with the same people too. And where the shifts that I pick up now at Elements, I usually pick up like 2 shifts every other week. And so, and sometimes randomly, like I'll pick up more on break and less during really busy times. And so a lot of clients will be like, they'll want to see me, but then I'll feel bad that I'm not necessarily on the books when they want to see me. So I'll recommend other people as well. Yeah. Then, and when other people see the same clients, Jill and I mentioned this briefly yesterday, but you'll see a big difference sort of in the quality and detail of people's chart notes. And so
That's
you
kind of what I
kind of,
was like getting at right there.
yeah, so you kind of take other people's chart notes sort of with a grain of salt. Like you kind of look at it for sort of trends of maybe what was being treated and maybe what things they tried. But you don't necessarily take what other chart notes say sort of as a be all end all. But I'll see examples of, like, for example, in my last few weeks of clients, when I look back on the charts, I saw things like somebody who had tried cupping before, or somebody who had had a certain condition treated, or somebody's notes said they liked the use of heat. And so I'll use those kind of to ask the client follow-up questions, like, oh, I noticed you had cupping before. Is that something you're interested in today? And I had one woman basically say, hell no. And I had another person who was like bringing it up, even though she didn't like pay for it that day. But she was like, oh, could you do cupping? And we can add it last minute. So I was like, yeah, I can definitely do cupping. So yeah, I use it as kind of ideas, but definitely not to assume that, like, first of all, the massage therapists don't all have the same knowledge. They don't all take notes on everything they do, and they don't all have the same sort of toolbox, right? So for example, myofascial release or craniosacral therapy or acupressure or Himalayan salt, like trigger point release, like all these things might help somebody, and maybe the people they worked with didn't like offer those things or chart them or know how to do them or whatever. So yeah. Does that kind of bring up follow-up questions or ideas? I also wouldn't be intimidated by what other people do or chart. Like there's some people where I work that sort of have a reputation for doing like super, super, super deep work. And I will sometimes get their clients, and I do not have an approach of sort of like beating up clients. And so, but just because I see that they go to that therapist and they've had really deep work, I don't assume that they're going to not like my massage, because oftentimes they do. And sometimes it takes a little extra communication and sometimes not. And they'll be like, oh, wow, I really love this. So yeah. Yeah. Any other questions so far?
That just kind of makes me think like about, in a way, it's good to stay in your own lane and not really comparing yourself or be intimidated or whatever by other people. I mean, I even notice it's kind of a different thing, but in this class, for example, like some people are, I've brought this up before, getting way more practice at massaging than I am. and it's hard for me not to feel intimidated by that. you
Yeah.
know,
Yeah.
because I'm like, man, it's
Yeah.
just like, it's in the practice.
Yeah. Yeah. So the comment in the classroom that you probably can't hear, and I'm paraphrasing, is sort of like the kind of idea to try to not get intimidated by others people's work and to also kind of stay in your own lane. And I mean, I've worked at a lot of places where there's a lot of massage therapists. And as long as the massage therapists are not like kind of trying to triangulate each other or one up each other or like put each other down or like any of that kind of nonsense, which of course could exist at some places. But if that's not going on, like I think honestly, like some of massage is sort of just like what the client feels comfortable with personality wise. And then also that for a lot of clients, a lot of different approaches will work very well. So even if somebody responded really well to craniosacral therapy and you don't do craniosacral therapy, not to get intimidated, because probably the things in your tool belt or toolbox can also help them, right? So yeah, a lot of clients respond well to a lot of different approaches, and some clients will even mix it up on purpose, right? Depending on what they need that day, you know, maybe because a lot of our clients have had a lot of massage, right? And so they may know that when they're feeling a certain way, they are wanting a kind of more gentle, holistic kind of approach. And then when they're feeling another way, they want to like get in there and have somebody kind of like take them apart and put them back together. And so they kind of, some of our clients mix and match like that as well. So yeah. And there'll be times when you're not a good fit for somebody, and usually that's not the end of the world. You know, hopefully you work at a place where they support you and, you know, don't throw you under the bus for that. And, you know that clients are not always 100% happy. And, you know, I knock on wood, I've had very good luck with clients, like not going, you know, ape shit on me and, you know, hitting Yelp, right, when they're having their little issues. But part of that is trying to keep those open lines of communication so that they turn to you and not Yelp to let out their frustrations. Okay, so what I'd like to do for this first part, then, like we did with the integumentary system, where we kind of really talked about, well, like what are the overall arching themes of massage problem solving or massage approaches in integumentary system, you know, and a lot of it was about is there a break to the barrier of the skin, right? And that we're not touching that, and how pretty much almost everything in the skin conditions are at least locally contraindicated and sometimes other. And so we're trying to look for those general patterns, right? So for the nervous system, you know, before we get into the weeds of specific conditions, some of the kind of general things to consider are that a lot of what massage can help in the nervous system are if nerves are entrapped or pressed on, especially if it's because of muscles or fascia, that sometimes we can help by getting fluid flow going and by releasing restrictions in fascia and muscles. And so that's why I pulled up this kind of review screen here of the anatomy, and using an electrical wire analogy. But what nerves are not just like wires, because remember, they send that electrochemical signal. And so they're also sending a fluid, you know, there's a fluidity or fluid in the signal as well. And anyway, nerves are active in a fluid medium, and when they get pressed on and when the fluid flow stops, that can interrupt the signals. And so some of the conditions that are in the nervous system that massage can help are like peripheral nerves being compressed or impinged. And, some examples of this that massage are very helpful with often are thoracic outlet syndrome and piriformis syndrome, which is often confused with sciatica. It has very similar symptoms. And sometimes, carpal tunnel syndrome, other times when the nerves are compressed. There's even a massage modality that I have not learned yet where they're specifically working with freeing up the nerves sort of directly. And I haven't studied that, but I do know that our other modalities can help quite often when those tissues are pressing down on the nerves. So we will have labs on thoracic outlet syndrome and piriformis syndrome and so forth, and massage is helpful for that. And so we'll come back to those, but are there any questions for now? Now, I mentioned particularly if it was right, pressed on because of connective tissue or muscles, but let's keep in mind that, the cause is not always because of muscles or connective tissue, right? So nerves could be pressed on by bone spurs, so basically bony growths. And depending on where those bony growths are, they could be even inside the spinal column, in that case, an osteophyte. So in cases like that, we can't help where that bone is actually pressing on the nerve, but sometimes we can still help just sort of palliatively, or even with some of the pain and some of the relaxation, but not the actual cause of that pressing on it. Similarly, with thoracic outlet syndrome, there's different places that brachial plexus can get compressed. Several of the causes are muscular in nature, but also there could be an extra transverse process sticking out further. It's not an extra transverse process, but it's a transverse process that sticks out further. So it's called an extra rib. And anatomically, that can press on the brachial plexus. So that's something that we couldn't help with. But if the clavicle or the coracoid process was pressing on the brachial plexus because of other muscles and fascia pulling those two bones in the way of the nerve, then moving and opening that so those weren't pressing on it anymore could help. So, in the context of massage therapy, we've been talking about these peripheral nervous system mechanical disruptions. So again, we can often help with those. If something is happening in the central nervous system, we can't really massage, directly there, but massage can oftentimes have indirect benefits. There's a lot of conditions that fall into this, but, sometimes it's the signs and the symptoms that we can help with, or if the client is experiencing pain because of their condition or discomfort, if stress is making it worse, right? Getting them into parasympathetic mode. Massage has been, there's plenty of research to show that massage supports in that way, including, in the central nervous system, if we're starting to look at, depression, anxiety, many of the mental health issues, massage can often be helpful, even though, there can be some complex causes, which we'll get into some of them as we look at that in detail, but massage can be helpful for those as well. Yes?
I just kind of more related to the peripheral nervous system.
Yep.
And if there's impingement type of issues, a couple of things came into my brain. So would we not want to do compressive type things, but more flowy, circulatory type of things because of the fluid? And there's also the nature of the fact that it's already impinged. And so we don't want to push down on it per se, but we want to flow out and separate.
Yeah, so there's a great question on the floor about if there is a peripheral nerve being compressed or impinged, do we maybe want to not do compression so much as kind of flowing kind of techniques? we wouldn't want to compress directly on where the nerve is already being pressed on. And the fluid flow is useful. So you do want to get your flow going. But of course, there can be compressed and compression of that nerve too with these tight fascia and muscles. So we can do our MFR to open the area. And then where compression can be helpful is basically anywhere other than right where it's being compressed. So, oftentimes there'll be trigger points as part of the pattern. And so, piriformis syndrome is a great example where, that piriformis trigger point is also an acupressure point and is also right where, the sciatic nerve is getting impinged. But it's helpful to release that trigger point and then get the fluid flowing. And then you're going to have that's an external, rotator muscle. So then you start your problem solving, right? Of you're going to, whether it's synergist, whether it's antagonist, and really start working with the whole pattern, but you get that fluid flow going as well.
Yeah, so that's what I was thinking. So there could be fascial restriction on top of the impingement.
Yeah.
And so you do want to separate that, but not necessarily right there in a compressive way, but to stretch. And so the MFR.
Yep.
And to separate.
Yep. Stretch, separate.
And you could still do the friction, but just not the pushing down kind of thing.
Yep. And cupping, right, would even be good because you're then pulling instead of compressing. But as you do all those things that are releasing, right, then you can be doing your compression on your trigger points. And and you mentioned great parts of the pattern. You're also going to have the person now, right, if they're having a nerve, if their nerve is compressed, what are they often feeling?
Tingly.
Numbness.
Tingly.
Yeah, I'm hearing a lot of tingling, numbness, radiating pain. Sometimes sharp shooting pain, right? So when your client, and then oftentimes limited mobility and this protecting their body because they know certain movements are going to send this shooting pain, right? So then we're starting to think about that too, right? They're now protecting their movement, they're compensating their movement, they're in pain. So we're working with those patterns too.
What's that pain cycle that we've been reading about?
Yep, that pain cycle, right. And there was one more piece to it. I think I kind of lost one little thread, but that's a lot of it. Yep. And we can help them a lot. I've helped, I don't know, maybe 100 people with peripheral nervous system stuff. Piriformis syndrome is very common, thoracic outlet, carpal tunnel. There's other areas where nerves can get compressed, and we can often help them a lot. And this can be a big game changer, right? You're going to have a lot of clients coming in, and whether it's their piriformis sciatic pain that hurts their butt so much they can't do things, or their thoracic outlet that hurts their neck and their shoulder so much they can't do things. Same with their carpal tunnel, right? And a lot of these folks can be a little desperate too. You take the example of carpal tunnel syndrome, and most doctors will tell them to get surgery right away. They're not really. There's other conditions where it's a little more common to suggest PT, OT, acupuncture, massage, whatever. But for some reason, the doctors love to tell clients to get surgery right away for carpal tunnel syndrome. So you're definitely going to have folks coming in who are like, my doctor told me to get surgery, but I really want to try other stuff first. But of course, their activities are limited and all of that. You guys came up with a lot of the great things. I did think of my other little, thought, which actually leads into, I think it's on Yeah, it's on this caution here is that you with these nerve
If you're
conditions.
moving your screen share, we can't see anything. It's just frozen.
Okay, let me try stopping it and starting it. Thank you. Sometimes it freezes. Can you now see major cautions?
Yeah.
Awesome. Thank you for letting
Yes.
me know. So this last kind of point about the peripheral nervous system, it brings up, right? You already brought up numbness, tingling, sharp shooting pain, and all of that. One of the things to consider for your cautions that's overall for nervous system, it comes up for different conditions, is when there is numbness, whatever the cause, we're careful locally, right? When there's numbness in a particular area, we're not trying to change the tissue where it's numb. So sometimes we know what the cause is, right? Like there might be an impingement upstream, or it could be more something like diabetes causing, peripheral neuropathy in the feet, which is super, super, super common. You're definitely going to have patients who have that. But the overall caution, right? Because again, we don't always know the diagnosis, is that we're being careful locally with the numbness. And then of course we're letting our clients know also that if we're doing range of motion or stretching or prolonged ischemic compression or trigger point release, or really any of the techniques that we're doing, we also let them know to let us know if anything is ever numb or tingly or so forth. And then of course we stop. And if we're stretching, we ease up and we move on. Does that part about numbness bring up any questions or comments? So we're not trying to change the tissue where it's numb. Now that's sort of a textbook answer and a test sort of answer. In real practice, there might be more subtlety to that, right? Like as long as you're doing something that's non-invasive and gentle, then you might do something that's very gentle that might change the tissue locally, but you're not getting in there with deep tissue and so forth. So I'm giving you the textbook answer there. But there's all kind of things that you can do that would be gentle and non-invasive that would be safe.
Can you give some examples? So say, are you talking about maybe kind of a flushing circulatory type of thing in that area? And what example, an example when you might still do that?
Yeah, so the question is kind of like, could you give an example? And so I could come up with a couple examples. Let's say we were talking about some numbness here around the carpal tunnel. You wouldn't go in there directly and do cross fiber friction. But you could do positional release. And we haven't really done much positional release yet, but it's one of those techniques that we're not going to dive super deep into, but we'll teach you enough of the basics and practice it so that it's something you can start to dabble in and add to your toolbox. Cool thing about it is it's very safe and gentle and non-invasive. And so a lot of techniques, you kind of work towards say in the stretching direction, right? So if the hand was kind of in like this, a lot of times, a lot of techniques are kind of working to sort of bring it out into sort of the ideal position. But the basic idea about positional release techniques, and there's multiple different names of them, including strain, counter strain, and orthobiotomy. The basic idea is that, if the body was say like this, it's doing that for a reason. And that instead of trying to put it how it's supposed to be, you work with how it is. And so if it's sort of flexed in on itself, instead of trying to extend it, you work and you go into that position and you gently exaggerate it. But because it's the position of ease and it's not a position that's going to put pressure on the nerves, it's a safe thing to do to even kind of go into that. And then you just basically add a little pressure. I'm showing you a simple example so you can see my hand in the screen, but this would be done in many different areas of the body. And it's how, for example, massage therapists can do a rib release. That's in our scope of practice, because we're going into the position of ease of the rib and working gently with the fascia, not doing a chiropractic move, which is out of our scope of practice. So that's one example. A tuning forks, a Reiki. I mean, those would be other examples. Yeah, online, is that Mary?
That's just me.
Just me, yeah.
So chiropractic.
Yep.
Would you say that should you go to a chiropractor and then get a massage? Not in the same day, obviously, but which order do you think would be better to like stimulate growth and healing?
Yeah, I mean, I think there's different theories depending on what your condition is, but in general, what often works is to get the massage first, because it really works with the soft tissues and kind of changing the patterns. And so a lot of chiropractic offices that use massage therapists will have the massage first and then the chiropractor. And like the chiropractor I went to a week or two ago, he does a lot of soft tissue stuff too. So he was doing the like stretching and soft tissue stuff first, and then did the, the adjustments. So in general, I would say the soft tissue work first.
Thank you.
You're welcome.
When you were using this example of the hands and stuff like this, that made me think of a client who has had a stroke.
Uh-huh.
Is that a situation that you would be working with that person in that way? Have you worked with people who've had strokes and then like worked with, a limb that is like that?
Yeah. So the question is kind of like that. My example made Anna think about like a person with a stroke. Is that a time you would do that kind of technique, like with the hand? Have I done that? Yes, I've worked with folks with strokes, and that is a technique you could use. Actually, I want to play it. It's fun. It's a great segue that you asked that question, because I wanted to play a short video from Ruth Werner, your textbook author, who talks about a relatively new thinking around stroke healing, and how not so long ago it was assumed that so much of what was going on was central nervous system issue and damage that there was not much we could do, and that there's some thinking around how the peripheral nerve patterns specifically related to proprioception, that we can work with the proprioceptors to help re-educate the client's movements and kind of help them heal in that way. And also acupuncture is also effective after stroke. So kind of those are several approaches. And after these couple more points, we'll watch this little bit about proprioceptors, before we move on.
Where's the line, would you say, with somebody who's had a stroke between someone getting massage therapy and working on something like that and like an OT?
Yeah, good question. So it's kind of like, where is the line between massage and OT, right? Or PT for that matter? It's a great question, which comes up in a lot of different settings, right? I mean, one way to think about it is that OTs and PTs and doctors and neurosurgeons, right? They all kind of have like a higher scope of practice. So if, the client could definitely be seeing those folks for those conditions. And I would basically not override anything that they're doing. But that doesn't mean that if the person's coming to see you, like we can still do that work, right? We're gonna work a little differently, right? Doing like a positional release, like strain, counter strain, and our other techniques are not the same techniques that an OT and a PT are going to do. And an OT, right, of course, that's an occupational therapist. They're going to be focusing more on the person retraining for work and daily activities, and the physical therapist is going to be doing exercises and so forth. So that's not really going to override the massage techniques we can do. The other thing about strokes is that there's definitely some evidence that more healing can often be done with the treatment coming sooner. So, acupuncture, massage, OT, PT, yeah. All right, so just a couple more main points here, and then we'll move on to this little video introduction about this proprioceptive topic I mentioned. And then we're going to do some activities where you're doing some diving into things because, again, you're to kind of simulate how in your real practice, there's times when you have to be figuring things out. And, we're going to spend some time doing that. So we talked about numbness in nervous system conditions, especially like central nervous system conditions. Sometimes there's conditions where there's a verbal communication problem. So whenever that's true, we have to be extra attentive to nonverbal signals. Sometimes that's to the point of like working with a healthcare team of whether it's actually the person's loved ones who know their signals better, or sometimes it's their medical team who knows their signals better. So that comes up sometimes. And then medications, of course, very different medications for different nervous system conditions. But again, we're going to see clients on a lot of antidepressants and anti-anxiety medications. One of the main points that your textbook author was bringing up is that sometimes clients will feel so much better from their massage that they want to stop taking their medications. And her point is that, obviously it's not in our scope of practice to wean people off of their meds or to tell them not to do their meds, right? And so that's a good, like if the person is talking about that sort of direction, that's a really good thing to them to work with their primary physician, who might be a naturopathic doctor or a Western doctor, or even a registered nurse. And we'll talk about some of the specifics of that, with regard to different conditions. But, as I mentioned before, like since it's so common with antidepressant meds, some of the things to keep in mind is that, again, it can take like really weeks before those are even onboarded in the system. And for different clients, they really need time to figure out what works well. Sometimes, of course, they don't feel like any of it works well, or they don't want to take that approach. And so, definitely clients will be approaching this differently. And and one of the side effects that you may know from antidepressant meds, some worse than others, is actual suicidal ideation. And so, that's something to sort of track as well, right? That can be a real risk of some of those medications. But questions so far? And you're going to work in different settings, right? And in some settings, you're going to have a more time for a more complete health history, but all of your clients should at least have a medical history. We're going to talk about this more with soap charting, and we're going to practice a lot more when we're soap charting and in clinic. But sort of an important point is that a lot of clients, like all humans, strongly dislike medical charts. They're tired of filling them out. There's a zillion reasons why they don't want to fill them out. They've maybe filled them out 100 times. They also might not think it's relevant to massage. They might also not think it's our business. They might think it doesn't matter. And also anything that's stigmatized, or in other words, judged, like people are going to be reluctant to share that, right? They're not going to want to share something that they think you're going to judge them for. And that can be true of many different things, but including mental health care, medications. And so some of that is dependent upon the relationship you build with the client and them being learning that you are definitely not judging them. But some of that goes a lot deeper, right? And they're not gonna share, right? No matter who you are. Does that bring up any questions, comments?
That kind of scares me to think that if somebody wasn't diagnosed with something where I could make it easy to find them because they didn't talk about a medication or something that was going on with their body.
Uh-huh.
Yeah.
Yeah. So kind of the point on the floor is that, it's kind of scary that people might not share things that are relevant. The good news is that massage is pretty safe, but it is a very valid point. And sometimes people don't share stuff just because they don't think it's important, right? A lot of people don't know there's as much clinical problem solving or thinking to massage as there is. And so sometimes it won't even be because of stigmatized issues. Sometimes it'll just be like they don't think it matters. So for example, and that's another reason why we really have to really do our most cautious approach to massage, right? And know that the client's not always going to have a diagnosis for everything. We're not always going to know what's going on. And so we have to take a safe approach. Now, the good news is in most cases, what we're doing is quite safe. But I'm going to give you probably the most dangerous common two examples I can think of. The one is going to be less shared less often. So probably the most dangerous example I can think of is that clients with low back pain may not know the cause. They may not have had MRIs. And we don't want to press down on their lower back vertebra where they might actually have like a herniation or a slip disc or a degeneration, right? So that's somewhere where with a lot of pressure, we could hurt somebody, right? So that's like, we can do a lot of great things for their low back that are not pressing right on that spot. And we can just let our clients know why, right? Unless we really see an MRI and know the diagnosis from their doctor, we don't want to mess around. So I would say that's like a no-fly zone, right? We got to be really safe, like not pressing directly there. But we can help them by working around their glutes and the ischial tuberosity and their hamstrings and their quadratus lumborum and their erector spinae. And so there's all these great ways we can help them with their low back without doing anything dangerous. So I would say that's like a really common example. Where you might actually harm them if you were like, oh, okay, well, I'm just going to guess this low back pain is like muscular without really knowing what it is, right? So, yep.
Well, with that, so are you specifically saying, like, obviously don't compress their spine, but the muscles around it, because many people come to massage for low back pain.
Yep,
right?
yep, many people do.
You want to help them with that.
Yep.
So you're just saying stay off of their spine.
I'm saying stay off of their spine.
Which we should anyway, right? I mean, I guess with cups, you could, and that would be important to know.
Well, like if we knew that their low back pain was not like a herniated disc or like a slip disc or something, we could work closer to like the rotatories and multifidi and so forth, right? But yeah, we're staying off the spine. It's okay to work with the muscles. Yeah.
I tend to, especially since Lucy was like so adamant about this, of the lower back, I just kind of am over on the sides.
Uh-huh.
Do you tend to work with right next to the spine a lot on the lower back?
Not a lot on the lower back. I'll work with the quadratus lumborum.
Yeah.
Yeah.
Okay.
Yeah.
Yeah, I tend to kind of go to the sides below that.
Yeah, I mean, so that's a good example. But yeah, there's a lot of times where, yeah, I mean, the nerve caused things, right? There's like, you were bringing up earlier about like not pressing down on them directly, right? That's like a good example. And other times are like, when to refer, right? That something might not be neuromuscular in nature, and that really they should get a diagnosis, because like maybe that referral pattern of pain is actually coming from their gallbladder or liver or abdomen, and something that needs to be treated, right? And so and that's more about them getting that treated really than necessarily you hurting them. I mean, I suppose you could, like, let's say somebody had abdominal pain, not diagnosed, not that we touch people's abdomens usually much anyway, but let's say they said they wanted core work, and you just assumed like, that was like a core muscle thing, or you wanted to get into their iliopsoas, and let's say it was actually like appendicitis. Obviously, that's a medical emergency, right? That's not something that fascial work is going to release. So, I mean, there are some cases where, it could be problematic, but in most cases, massage is safe enough that if we follow some basic things, I guess, people could not disclose, like a pacemaker or a medical stent, or like something they just didn't think to tell you, that if you're looking at what you're doing and paying attention, that, you'll hopefully like see those things, right? Just to stay away from them, right? To not like dislodge them or get them infected. In the case of a stent, not a pacemaker, you can't get a pacemaker infected. Yeah, so things like that. Yeah, I hope that alleviates your concerns. You just might not, you might just not get as effective of a treatment, right? As if the client doesn't really feel safe enough to trust you to be honest enough about what's going on, but you're not likely to truly hurt them in most cases.
Well, it seems like too, like even you mentioned like the gallbladder or whatever, if they have something abdominal going on, you wouldn't know if it was a muscular thing necessarily, or like something more serious that was unrelated, that they needed a referral, they needed to go.
Yeah, well, in the case of the acute abdominal issue, that is a time for them to see their doctor, right? That's not a time for us to think, oh, that's muscular in nature, right? So, and we wouldn't know, right? There's a lot of things we don't know, but that's something that they should go get checked out. It could definitely be an acute situation, not just appendicitis. It could be other issues as well. Yeah.
So I have a question. So
Yeah.
Speaking of like clients not disclosing information, or like, say like for instance, they don't know that they're going through something at the moment. So say like a stroke or a silent stroke, and they just think it's Bell's palsy because it starts with like, the muscle weakness on the side of the face. Like, what do you do in that situation? Like if the Bell's palsy that they think they have is really, like going into a stroke.
Yeah. That's a harder one. I've never seen it in my clinical practice. The question is kind of like, what if somebody just thinks they have something like Bell's palsy and it's like actually a stroke? I think, again, it's never happened in my practice, and I have treated folks with Bell's palsy with acupuncture. I guess it just points to sort of when there's sort of signs and symptoms that you need more information. It's always your job to ask questions, and never to assume that the patient is just going to volunteer the right information. And I think where this comes up a lot is very often your clients will have had car accidents and surgeries and other injuries, and they're not usually going to tell you really any of the right information that you need to know. So then you just need to ask them, right? Like the old Dr. Ficaria and all the things you need to know. But, starting right off with, when did it happen? Because it's a very different situation, right? If this was like yesterday, last week, or a year ago, right? And then what kind of treatments they had and where the pain is and all that kind of stuff, right? But so I guess, the first thing it points to is just asking the follow-up questions. And when in doubt, right, you can always refer out. And this last point may sound a little out there, but also just really trusting your gut, right? You always err on the side of caution and always trust your gut, right? Because again, we're not doctors. We don't have any medical tests, really. Like, we don't have any medical tests. Like, we can understand a few things about tight muscles and fascia, and really that's it. I mean, some massage therapists might do some testing on areas to kind of see, like, does this seem like it's maybe, are we getting some signs here that this is like in the joints or the soft tissues? Or end of the day, though, we don't have any, it's part of why it's out of our scope of practice, right? Like, not only do we not have the training, but we're not looking at x-rays, MRIs, urine tests, blood tests. I mean, there's a whole host of information we don't have, right? So when in doubt, there's really times when it's like, yeah, really, you should get that checked out. And if they don't have healthcare, or they don't believe in doctors, or there's some other routes, right? Like, sometimes folks will be open to a naturopathic doctor or an acupuncturist, but not a Western medical doctor. And I would say first the naturopath if we're talking about something that needs to be diagnosed, because acupuncture can treat a lot, but they're also not using any diagnostic equipment, whereas naturopathic doctors can use at least blood tests and urine tests and things like that. So, yeah. Or sometimes in the case of a chiropractor who can at least like take x-rays. Yeah. So it's okay to say, what, this is beyond my scope of practice. I don't know what's going on. I don't feel safe until you get treated. And so I can't see you at this point. And sometimes it's that. And then sometimes it's, until I know what's going on, I can't treat this part of the body. But if you want like a relaxing, like foot massage or, something else, like sometimes it's okay to do other treatments. But sometimes it's truly like this might be a medical emergency. I can't see you today. You should really go, get that seen. Yeah. Any other questions or comments? All right, so we have one short video and then we can take a lunch break and do some activities after lunch. I'm going to pause our recording because this is a copyrighted video. So you have it in your module. We don't need to have it on YouTube or anything like that.